So tell us, what is the biggest challenges facing healthcare CIOs today, and what can be done about it?
Oh, I think the more technology that we're taking on and the more digital strategies that are being implemented, it's even more incumbent upon our technology leaders to help their organizations understand the organizational change management that needs to come with that new technology. That is a daunting task to change those long-lasting and well-entrenched processes and procedures that have just gone on for a long time, and you can't just layer technology over the top of that. So I think for our technology and CIO leaders and even our CISOs, their main goal is to help their organizations understand the value of that technology and how to really operationalize that technology in their environments. If they can get that accomplished, then we can create more efficiencies, create a better patient experience, create a better provider experience, and all of the technology that we're looking to really get integrated now comes together.
Yeah, I believe the list is going to be long, but I have to keep it short. On top of my mind comes the information security, all the threats that are clear and present every day. So that's what keeps us up every night. We have to make sure that we stay a step ahead of the bad actors, and that's what's most important. That's number one. Number two, I would think that is the people. For my leadership style, I always make the people a center of my strategy. So I have to make sure that we continue to able to hire the right resources, train them appropriately, and retain them. And number three is the technical debt. In the healthcare industry, we have a lot of older systems and older technology. And in the past 3 years, since the focus has been mostly dealing with the pandemic, so we have a lot of technical debt that needs to be dealt with, which means that retiring some old systems and do the cloud migration where necessary.
So healthcare CIOs, like most other industries, have a normal challenge of keeping the run part of the organization smooth, efficient, and resilient. So we have that. But I think where we are in healthcare is on a cusp of transformation. So really the transformation and the growth which leads to more business, transforming the patient care and really creating efficiency is where most of us are facing the challenge.
Interesting.
What can be done about it? I think that the best way to do it is if it's weaved into the organizational strategy, then you really get the buy-in, because technology happens to be only 40% of it. Really, the remaining 60% is your operational alignment. That's what we're learning with digital transformation. That's what we're going to learn with all of our AI-generated transformation too.
CIOs have a tough job. I think the biggest challenge is the mismatch between demand for their services and budget and resources within the group. Economics in hospitals are shrinking or challenged currently, as everyone knows, yet the demand for IT services and CIO services are exploding in growth. This is very difficult. So the answer has to be efficiencies, consolidation, doing more with less, and not getting consumed completely by operational tactics and being a leader in the organization at the same time. Very difficult, so that is a hard challenge.
So there are multiple challenges, John, but I think the two most important ones are retaining and hiring healthcare IT resources. And I think there's just so much competition right now that you have to provide better benefits. COVID has introduced this whole thing of work from home. People have gotten used to it. So I think that flexibility has to be provided to the right people. And also a lot of training, mentorship, some career guidance, which I think is missing right now. And then the other challenge is physician burnout and turnover due to EHR usage and burden. And AI and technology is really what can help with that. Like you can provide scribes for documentation, some robotic process automation, AI-assisted tools for physicians, and some programs that talk to them about the burnout and how to solve that. So I think those are the two most important challenges that I see for CIOs right now.
What our customers tell us all the time, very, very privately, is they're so worried about their data. Nobody feels great about their data hygiene. And I think they're really afraid to have those conversations internally with their key stakeholders because it shows some vulnerabilities. And there are so many priorities right now. They only have so much time to take a look at that data hygiene. And yet, foundationally, if you don't get the data right, you can't get any of the other things off the ground. So data just remains absolutely critically important to our CIOs.
Well, right now, a lot of it's cost pressure, a lot of it's margin improvement, a lot of it's financial. So we work a lot with CIOs, number one rated class firm in IT advisory. And number one thing they tell us is we're just trying to deal operationally, financially with all the different challenges hospitals are dealing with as well. So we spend a lot of time with them, IT operations. Big challenge for them. Getting good managers, being able to run projects, being able to track ROI, measuring the success of IT, because there's a lot of new technologies, a lot of AI talk, a lot of automation talk. You hear it a lot here, you hear it a lot with cybersecurity, and all that's money, but all of it needs to be traced, needs to be tracked in terms of dollars, but also performance. So they're really struggling with that. And we do a lot of work with them on that, and they are here at this conference talking a lot about it. And IT operations, number one thing you see. Now, I would add to that a lot of CIOs need IT operation officers, deputy CIOs to help them in terms of managing IT organization and IT operations. I had a really good one in my role at Columbia when I was a CIO there, and I recommend it to CIOs all the time.
Well, John, the number one thing that we're seeing in the shortest term are budget constraints with respect to the expense that they have to manage to maintain all the software applications to support this massive enterprise. So in the short term, the enormous growth in data that's driving, frankly, cost, and cost in that vector of management of those systems.
I think today the biggest challenges are probably security. So one of the probably the easiest piece with security is to reduce the IT footprint. So getting rid of disparate systems, reducing as many down to a smaller number that you can, close gaps, and really identifying where those breach areas possible are found.
Oh, good question, John. So I think if you think about the trajectory of healthcare CIOs, their job used to be around delivering solutions that make good partnerships with clinical work. So how do we use technology to help deliver care in a better way? But I really see the next challenge is now that we've adopted digital healthcare across the EHRs, are really thinking about how to become a better partner to the business. How do they help the business grow? How do they help the business have the insights they need to operate at a lower cost, better care, and really seeing that CIO playing a very more strategic role.
Interesting.